Hello and welcome to Unleashed. I'm your host, Will Bachman, and this is one of our series of short AI case studies. I'm pleased to welcome today Julie Noonan. Julie, welcome to the show.
Thanks, Will. I'm glad to be here.
So, Julie, thanks so much for agreeing to share a case study that you've worked on related to artificial intelligence. Walk me through your case example. First, why don't you set up the context for us? What was the situation?
Excellent. I certainly will. So, in working with a top 15 global pharma company, it became readily apparent a couple of years ago that they had obviously tons of data and needed to educate their population, particularly in research and development, on how to best use that data and use artificial intelligence and machine learning in order to get the most insights out of that data to reduce the time to market or time to development of their particular molecules and drugs. So the organization that I was working with is a digital and data concentration. Most of the individuals in that organization are data scientists and computer scientists. So one of the things that this organization decided to do was to create a center of excellence so that not everybody was jumping on the AI ML learning bandwagon, but they had kind of a frontline group of individuals that were staying at the leading edge and advancing their particular agenda toward AI and ML, as opposed to, everybody and their brother taking time out from the drug development process to learn about it. So my job was to enable this center of excellence to figure out how we could take several different perspectives on creating it based on what they were really trying to accomplish. Their objective was to, first of all, educate. Second of all, to provide a sandbox environment where individuals could go in and play and learn the tools like Python and R. That was a couple of years ago. And work with data that didn't really matter so that they weren't, messing around with data that was critical to the company. And then third of all, they needed to put together some sort of an ethics and governance process so that individuals who thought they had a project that could be forwarded by using AI and ML, there was a committee of individuals who were experts on the topic, as well as experts in the subject, in the domains, in the business domains. They could actually sit on an advisory board, read through the project proposals, the business case, and then also the technical implications, and provide a yay, nay, or go back and get this other information. So those were the three objectives that we worked on with the COE.
Talk to me about some of the use cases that people throughout the pharma company might have been coming up with to use artificial intelligence or machine learning. And you mentioned that this was early 2022. Okay, so this was sort of before ChatGPT came widely available in terms of generative AI, but certainly lots of machine learning and artificial intelligence tools were out there. So what were some of the use cases that were coming up across the company?
Most of the early use cases involved clinical data and research data that were being captured within the company through the research process. So, for instance, a clinical group would be running the first clinical trials, with animal populations. They would be recording their data in various and sundry tools. But the molecule that they were, and I'm not a pharmacist, by the way, so I may be messing up this from a pharmacy perspective or a drug development perspective. I might not sound that great, but what they were trying to do was to see not just for a particular project what the data was showing, but for a particular molecule that they were studying, what all of the implications might be across projects. So, for instance, they would be looking at a particular module, a molecule, and I'll give it a name XXX375. They were looking at this particular molecule. The results that it was giving us for one disease indication, but they wanted to also use AI and ML to predict if it could have relevance for some other disease indication that it perhaps another team was working on. And they wrote prompts against the data. They were able to define a way to put all of their data into a data hub, a data lake, and they were able to then go up against that data and organize it and prompt it such that it comes back with possible other indications that could be tested with the data that they had already collected.
I imagine and strongly would guess that a lot of companies are trying to figure out organizationally how to deal with the rapidly evolving AI technologies. And one solution is to do a center of excellence like you helped create. I imagine that some people might have, there's pros and cons to that. Some concerns might be that it's going to just add this big layer of bureaucracy, and someone out there has like a good idea of how to use AI, and they say, no, you're not allowed to just implement that and experiment. You need to submit it to our committee for review, and maybe we'll approve it. Maybe someone else will get, so it could like slow down innovation. So, but on the other hand, you have more governance and so forth, and you can get the expert people to work on it. So how did your client think about that trade-off, and how do you think about that trade-off for other clients? Would you recommend that other companies set up a center of excellence, or in some cases, maybe when is the right time to do that, and when is the right time to let 1,000 flowers bloom across the company?
Right. It is a tight balance. In this particular company's culture, entrepreneurialism is highly valued. There were multiple groups, and this is a huge organization, and it's a global organization. So as you can imagine, the central data and digital organization that I was working with wasn't the only one that was looking at should we ratchet this back in, how do we govern it, etc. The nice thing about the organization is that within reason, if what they said was, if you own the data, if your group owns your data, and you can just go forward with it unless it directly impacts a patient or a patient population. The other thing that they did, we were able to educate the groups that were interested, because one of the things that the culture of this organization does is it rewards innovation. So what's in it for me, for people who wanted to experiment and to do some innovative things, we made it rewarding for them to actually show those project ideas to this committee, because when they did, they were rewarded publicly for coming forth. They were rewarded even if the project turned out to be, not so great, or a failure, quote unquote failure. I don't think there is such a thing as a failure. It's just a lesson learned. But they also did a lot of upfront education around this is, if you do this well and if you do this right, then you don't run the risk of ethics violations. You don't run the risk of harming a patient. And that is the number one culture item for this company, is the patients first, always. So they hooked the incentives to the actual key cultural values of the organization, and recognized people that came forward. If someone did have an idea and they were out there, they were doing the whole cowboy Wild West thing, and this group heard about it, they reached out, not in a punitive sort of a way, or we need to look at this kind of a way. They reached out in a curious way and asked if they could see what was going on, if they could offer suggestions, but they never once pulled a project unless it was an ethical violation, and they had a whole group for that. But they never once pulled a project just because someone was being, innovative or entrepreneurial.
Okay, so they were using more of a a poll, they were not being punitive or shutting people down.
And
Tell
I'm
me,
a
oh,
change manager, so
yeah.
that was part of my job on the team, is just to help them come up with, well, what's in it for me?
Oh,
How are we going to introduce this? How are we going to make it exciting? We did a lot of exciting advertising. We
yeah.
did competitions. We did a lot of partnerships with universities for particular projects. We ran several competitions with the universities that were also on the bleeding edge of AI at the time.
And tell us a little bit about like how that about some of that marketing internally, right? So
Hmm.
if you have a COE, there's is a big change management aspect to it of you can't just build it. You have to, you know, either convince people or make people
Hmm.
aware of it, just as if you were trying to sell consulting services externally, you have to internally make people aware, get them to consider it, get them to reach out. Talk to me about how you marketed it internally.
Of course, we had just extraordinary sponsorship for the initiative, which obviously is the key in my book of all change management initiatives. If the leaders don't live it, love it, and use it and disseminate the message, then no one else is going to pay attention. One of the key initiatives of this particular organization that year revolved around digital and data and transformation, as you can imagine, like, a lot of other companies. So what we did when we started to announce the existence of this Center of Excellence, first of all, the name that we chose for it, which I can't divulge, but the name that we chose for it was totally in line with the culture of the organization. It also reflected back on the annual message from the president, the CEO of the organization. We were able to use a direct quote from him on a lot of our marketing material, talking about how it's the future and how we could get drugs to patients a lot faster if we were able to slog through our data much better using AI and machine learning. We showed up at what we call pop-ups, where if there was a group that was actually doing an in-person event, this particular team would show up at that event with marketing materials, QR codes that people could link to go to our landing page, where they could then go out and access learning. That we had created a full 3-level curriculum for them with certifications included in some of them. They could actually go out also and jump into the sandbox and access some of that fake data and practice. They also had office hours, that if there was an individual who was working on something or had an idea, they could call in during those office hours and just shoot the breeze with one of the COE members to see if it was even worth exploring. And it was all very open, vulnerable. People could call in who didn't have a clue, and it was okay. That if they had this crazy wild idea but had no idea about any IT architecture or how AI worked or etc., they could call in, and there was never a stupid question, which was awesome as well. We did newsletter articles. We did postings on websites all over the company. This particular company used Teams, and so we used Yammer along with Teams messaging. We used video monitors throughout the company to tout the existence of the group, and it picked up. We also formed a community of practice, and the community of practice got together once a month for either an educational session. Sometimes the training person on the team would bring in someone from a local university who was an expert in AI, and they would talk about using R to do X, Y, and Z, or they would talk about how to parse particular data sets, or they would say, here's where you can go to get external data sets that are free from governments and such. We had the ethics committee come in and do a discussion about why it was important to make sure that your use of AI was ethical, non-biased, and had an element of DEI to it that would represent the patient populations that you were targeting, etc. So we did everything we could think of.
Yeah, no, that's pretty extensive. Um,
Yeah.
Amazing. So, how did you measure the effectiveness of
Hmm.
this center? I imagine that's tricky to do because they're giving advice and so forth. So, you could like
Hmm.
count the number of inquiries, or you could try to actually get into return on investment of we advise these projects that actually ended up, saving us money or something. So, what kind of KPIs did you use, or what kind of metrics did you use for this center?
The nice thing is that when you're starting from scratch, you don't have metrics, you know. So you basically say, okay, for this year, for the first year that we went out, we wanted to increase awareness. And how do you measure that? Well, how many people decided to join the community? We went from the people who were actually on the team, which was about six, all the way up to today, it is more than 1,500 people that are actually part of the AIML community. And that was pretty extensive, and it's global, and it's not restricted to one particular group like R&D or one of the commercial units. So that was one thing. Another thing was access and use of the learning, and also access and use of the sandbox. The third thing is the number of projects that were brought in to be evaluated and how many of those projects actually got legs and became true projects that then had their own metrics attached. So, for instance, there were, I think, 10 projects in that first year that were part of a competition with a local university. And so the teams of those projects were blended university and employees of this particular organization. So they worked together for a year, implemented several AI ML elements to their projects. And at the end of the year, they were judged not if the project had failed or succeeded, but if it had actually provided insight to the company in moving forward with a particular molecule on the drug pipeline. And I would say it was a 50-50 split, that first class, of what we would consider good project metrics and basically surprises or opportunities or lessons learned on the other half. That is tremendous in the pharmaceutical industry. Typically more drugs and more experiments fail than they do succeed. It was very successful first year for that competition team. I do know that there is now an entire 100 and some odd person team who works with the business units now on creating projects with AI ML elements and data elements. The number of data scientists has grown dramatically as well over the last 2 years.
Julie, thank you for giving us this overview.
Sure.
For
Uh-huh.
folks that want to follow up and learn more about your practice, where would you point them online?
www.jnoonan, Noonan, consulting.com, or you can link in with me.
All right, fantastic. We will include those links in the show notes. Julie, thank you so much for joining today.
Thank you, Will.